Welcome to The Authority File, the podcast where you'll hear conversations with academic librarians, technologists, researchers, and authors whose work is laying the foundation for higher education's future. I'm Bill Mickey, your host and the editorial director at Choice. If you're new to The Authority File, you can listen to and find previous episodes on all of the major podcast platforms, including Apple Podcasts, Google Play, Stitcher, and on our website, choice360.org. My guest for this series is Dr. Niklas Lidströmer. Dr. Lidströmer is a specialist physician and a postgraduate researcher in artificial intelligence in medicine. He's a founder of an AI-powered medical platform and has been the head of medical AI at a variety of medtech companies. He's also the co-editor of the Springer Nature title published this year called Artificial Intelligence in Medicine, a reference work that covers the challenges, opportunities, and ethics in the use of AI in medicine. In the next 4 episodes of this series, which is provided with support from Springer Nature, Dr. Lidströmer and I discuss his research background, his new book, How AI is Currently Being Used in Medicine, the ethical ramifications, and where academic librarians fit in the growing research and availability of medical data in the field. In this first episode, we hear from Dr. Lidströmer about his research and how artificial intelligence is being used in medicine today. Welcome to the program, Dr. Lidströmer.
Thank you so much.
So let's start with a little bit about you. You've got a deep background in clinical work, but how did you find your way into artificial intelligence in the medical field?
Well, basically, as you said, I have been working in many places in the world, 8 countries plus 1 year as a ship's physician. And when I worked with many electronic health record systems around the world, I was amazed how little it was used for any kind of research or intelligent conclusion making. So it was actually before we had the concept of big data, but all this gold mine that had lain there for decades was unused. It was not used for any scientific purpose. It's an untouched gold mine. So, and also I could see that all these electronic health records were not connected to each other, and the patient's voice, the will of the patient was absent, and also the vast amount of contradicted errors in electronic health records that could lead to mistakes and so on. So that sparked an interest in improving this. So I tried as an entrepreneur and as a researcher to start a project within EHRs. And I tried to convince others and investors, and I always received, this was actually 12 years ago, questions like, what is big data? What do you mean by that? And why is data valuable and so on? No one would likely ask those basic questions nowadays, but so that's how it started.
So when you say medical systems, these are the systems that would store the healthcare records
Yes.
the medical records that you're talking about.
EHRs. EHRs is the old term, electronic health record, but now we are more talking about personal health records and so on. It's we're coming to that later in the program, I think.
Right. Excellent. So along with Dr. Hutan Ashrafian, you co-edited the reference work, Artificial Intelligence in Medicine, which is published by Springer. Can you talk about that, how that title came about and why it's needed for the field?
Yeah, it all started in a naive, attempt to summarize what I had learned as an AI entrepreneur, and also, as you know, practice in medicine has evolved. We have a huge torrent of data, and we have become more and more enabled as clinicians to get our arms around this and to care for patients. So it's I saw AI as a rescue path, and in it, which I realized would transform AI in healthcare, or healthcare with AI, and for generations, and that I sensed, talking about timing, that this is a Gutenberg moment for medicine. And I tried to summarize it systematically, alphabetically, originally, with all the medical specialties. And Houghton and I, we connected at Imperial, and we concluded that for AI in medicine, there were no dominant major reference works, as in clinical medicine. You have, for instance, the Oxford textbook of medicine,
Hmm.
or Harrison's Principles of Internal Medicine, which is edited by your famous American Anthony Fauci, I think, or Fauci. Um, there was no such equivalence for AI in medicine. So we kind of thought, let's try to publish one, and so the result was AIM, the AIM book, the AIM book, or AI in Medicine book, which is an unabridged and completely comprehensive major reference work of all AI in all medical fields, both clinical and preclinical, for all of healthcare. So the result is 130 chapters, over 800 pages, 1,858 pages, I mean,
Wow.
and so nearly 2,000. And as I wrote, the first sentence of the preface is like, this is in all essence a book on the future of medicine, because AI will infiltrate. It's not a nice word, but it will definitely flood into all medical areas with no exception. And the same goes for library science, I think,
Hmm.
too. Yeah.
Yeah. So as you say, the book helps situate AI, artificial intelligence, in the medical field. So just going back in time a little bit, where did AI first appear in medicine, and when, and why were these the first applications for it?
Yeah, many people, well, generally people talk about the Dartmouth conference and so on, and McCarthy and so on. I don't think that Stanford University, their medical experimental artificial AI in medicine project, which was a time-shared computer system, it was created in early 1970s, I think 1973, and it was an enhanced networking capability tool among clinicians and biomedical researchers from several institutions. So it was multi disciplinary already from start. So in the 1970s, we saw the rise of the first AI applications. Now, ECG auto interpretation, for instance, is one which is maybe not generally regarded as one nowadays because we have become spoiled with it, but definitely an early AI application. And then in the early 80s, I would say, we saw a subset of AI, which we now call machine learning, which, or also traditional AI. It was first applied on medical imaging in the first 1980s, and it's based on that users must predefine explicit parameters and features of the imaging or medical image, and based on expert knowledge. So it's a question of image recognition. That was
Hmm.
probably the first field.
Why was that? Why was that the first place to start? Was that just sort of a low hanging fruit, or just made sense for it to apply it that way?
Well, I think partly it is. I'm not an expert, but in parallel with increased imaging capacity in, I mean, monitors and screens. I mean, the first computers didn't even have a screen, but in parallel with the development of other computer features and faster processors and the evolution of the computer image, how with
Hmm.
pixels and so on. I think that goes hand in hand. That the same mathematical development happened in parallel in two worlds.
Okay.
That's my non-expert interpretation.
Okay, great. So then fast forwarding to today, can you give us just a general sense of how artificial intelligence is being used in medicine, both from a clinical perspective also, and administratively, I guess. We're not talking just about robotics, right? There's
Yeah.
other
Right,
applications.
yeah,
Yeah.
exactly. People often are afraid of robots taking over hospitals and other planets and so on. So definitely no. So artificially intelligent computer systems are used already extensively in medical sciences. It's already here. So and common applications include diagnosing patients with CDSSs, as clinical decision support systems, end-to-end drug discovery and drug development. You can improve the communication between the physician and the patient. You can use natural language processing NLP, to transcribe medical documents. And you can remotely test patients, so it will empower telemedicine.
Mm.
Administratively, as you asked, there are clerical tasks, claim processing, clinical documentation, revenue cycle management, medical records management, and so on. And as I mentioned, medical imaging. AI is definitely intensively employed in magnetic resonance imaging. It's likely purely it's a princess sleeping on a bed of AI, in diagnostics. It's it's a broad spectrum, and many physiological acquisition protocols and diagnostic. And I mean, the diagnostic potential is immense. So diagnose wise, I mean, an image tells 1,000 words, and it's very true for medicine. So, and also it has changed my own, perception of what is uh, actually a medical specialist in some aspects. For instance, pathology, dermatology, and so on, X-ray specialists, because they are actually image pattern recognitionists in a
Mm.
way. So it's a pattern, but the pattern can be, a psychologist can recognize a pattern. I mean, behaviorally, biochemically, EHR textual patterns. A librarian may recognize search patterns in a researcher or whatnot. So, and then of course we have surgical robotics as well. I mean, when I did a part of my residency in surgery in intra-abdominal laparoscopy procedures, you have tools being stuck in through various ports, and there's also an optical tilting or um, uh, um, variation, so you can't actually see where the tool is. It's actually an optical moving of the object. You can actually mend that with AI. So there are many small and large applications.
Mm-hmm. Excellent. And you mentioned research and librarianship. I'm wondering if you could talk a little bit about how you think medical AI is being researched and developed as a scholarly discipline. And I imagine it can be very interdisciplinary across engineering, science, medicine, for example.
Mm.
Is that accurate?
Well, yes. I mean, AI is commonly employed and identified to identify patterns in large, I mean, complex data sets. And
Mm.
importantly, this data can be analyzed in a significantly faster, more precise, and more cost-effective way than with traditional analytical or manual methods. So it saves money and it's improving the outcomes. And for instance, in biomedical discovery, you have structural models of system analysis, cheminformatics, and so on. We have within the omics fields, omics analytics, that's called, genomics, transcriptomics, proteomics. Proteomics, that's a series of proteins in a system, for instance. And in precision medicine, which will give rise to individualized medicine and diagnostics, warning systems, even learning healthcare systems in the end, and monitoring. And then we have the next generation of clinical trials where you will be able to have an adaptive clinical trial with where you can monitor the treatment effects and also recruit patients powered by AI as well.
Mm.
So in
Okay.
its nature, yeah, I can just say it's genuinely interdisciplinary from start. We have engineers, computer scientists, mathematicians, medical specialists. They all need to sit together in the same room.
Mm-hmm. Right. So then, in recognizing who our listeners are, how do you see librarians supporting research in artificial intelligence overall? And perhaps more specifically in the medical field?
Yeah, it's it's an interesting question. First of all, I think librarians can benefit from the general AI administrational support that I mentioned. I mean, clerical tasks and so on. They're also applied in the clinical settings.
Mm.
Librarians can benefit from the AI administrational support. There are also for instance, natural language processing used for documentation. I mean, a librarian could use that too, naturally. And also, in the same way as in a clinic, you can free up hands for more complex tasks and human interaction. I mean, I believe that a lot of innovation and clever ideas come when you are having a purely human interaction.
Mm.
So more time for that kind of higher level librarianship,
Right.
and also so to compare again with the clinician or with a nurse or a doctor. I mean, you need to have a human in the loop in the clinic still, and librarians can be the human in the loop in medical research attempts. And also, I think librarians can use chat box that can answer more directional or simple questions or alerts when a new book is published, or other, or direct a customer to a specific library resource or so.
Mm-hmm.
So, and I think the rapid pace of AI development and adoption raises crucial questions about intellectual freedom, equity, privacy, automation, and so on. So there's an evolution of necessary literary skills among librarians to know about relevant intellectual property, policy frameworks, and so on. But that's so. I can mention context indexing, document matching. They're talking about the death of citation, for instance. That citation test, how it will evolve, that AI algorithm can quote in a much smarter way. You can also have AI that can summarize the content in a way that gives you a shorter version for research, but without missing the key elements. So as a bottom line, quality of service will increase, and I think librarians on steroids. That's like a librarian who knows the AI and how and the impact factor it can have for a better operational efficacy.
Yeah, that's great. You did mention something very interesting that I want to go back at, and that's the death of the citation.
Yes.
How does AI, I guess, advance the process of citation or the effectiveness of that?
Yes, I mean, the citation system can be perceived as a popularity contest, but it's a biased one. It's a biased. It gives a biased overview over a researcher's network or so, and AI algorithms which are based on the actual content of the paper, the core of the can create a far better mapping in that sense. So that, in combination with a summary or summarization, which I presume you can granularly kind of set what kind of summary you want. Maybe you want a certain type of summary. I just think that will increase the quality of service.
Mm-hmm. Excellent. Okay. You just heard from Dr. Niklas Lidströmer. Dr. Lidströmer is a specialist physician and a postgraduate researcher in artificial intelligence and medicine. He's a founder of an AI-powered medical platform and has been the head of medical AI at a variety of medtech companies. He's also the co-editor of the Springer Nature title published this year called Artificial Intelligence in Medicine, a reference work that covers the challenges, opportunities, and ethics in the use of AI. This series is brought to you with support from Springer Nature. Join us next week as we look at the benefits and challenges of AI in medicine and how it's changing the patient-doctor relationship.
I think it will empower the patient. As you can compare with Eric Toppel's book, The Patient Will See You Now. That's an interesting title. The patient may see the doctor after a home screening with a mobile device, as we mentioned, or another device, or online. So, and the patient may have already may already be aware of the results prior to taken. I mean, for instance, the full genome screening costs just a few tenths of dollars. Or gut microbiome tests, or they may have a monitoring ring or a bracelet or a Fitbit or whatnot. And so they may be alerted that something is boiling already.
As always, underwriting opportunities for the Authority File podcast are directed by Choice's advertising manager, Pam Marino, and all of our episodes are produced and edited by Choice's digital media producer, Sabrina Kofer, with support from digital media assistant, Ashley Roy. That's all for this week. Thanks for joining us.